After your first meeting with your care team, you'll have a better idea of what your treatment plan looks like for you and your specific type of cancer. Many patients' plans include medications or other treatments that are given intravenously or through a vein. Infusions may include traditional chemotherapy, fluids to prevent or treat dehydration, hormone therapy that kills or stops cancer cells, immunotherapy that boosts your own immune system to fight cancer, or other specialized treatments. These treatments are all provided at one of our outpatient infusion suites. In this video, we're going to walk through the steps of what a typical first infusion appointment might look like. But remember, every cancer patient is unique, so your experience may look a little different from what you see here. Your first infusion appointment is typically the longest, so plan on a full day. It is also important to bring a caregiver with you your first time if possible, because you don't know how your body will react to the treatment. Just like with your first clinic appointment, most of your treatment will take place in Pomerantz Family Pavilion. Check your appointment details to find out which elevator you need to take, and then follow the signs to get to that elevator. Your day will most likely begin by checking in for your intake appointment. A member of our team will then bring you back into an intake bay. We will take your vitals and blood samples if your doctor has ordered labs. Your blood sample and vital signs, like your height and weight, help your team determine your right dose of chemotherapy and other medications. After this step, you'll have time to sit and rest. You may spend an hour or more in our waiting area while our team is working hard behind the scenes to prepare. It is recommended that you bring something with you to pass the time. All patient areas have wireless internet access and reading materials, but you may also want to bring items like your smartphone, headphones, a tablet device or laptop, books, magazines, or other reading materials. You may also ask a clerk for a pager so you can walk around or grab food or coffee while you wait. We know it's hard to wait. You may feel like nothing is happening, but there's a lot going on behind the scenes while your care team prepares your treatment. Let's go check in on what they're doing. After your blood is taken, it is sent to the lab for analysis. We use your blood sample to check your red and white blood cell counts, platelet count, and kidney and liver function to ensure your body is ready to receive cancer treatment. Some cancers produce chemicals called biomarkers that can be found in the blood. Your doctor might also use your blood sample to test for these markers. They can use it to see how well your treatment is working. Analysis of your blood and lab work take at least 45 minutes to complete. Once they are ready, your results are sent to your provider to review, along with your vitals, to determine if your body is able to handle treatment. After reviewing your blood work, your provider will prescribe your treatment. This includes the name of the drug, the dose, the date of the treatment, how it will be administered, and how long the infusion will last. After your provider writes the order, your infusion nurse reviews it for completeness. The infusion nurse then releases the order to the pharmacy. The pharmacist reviews your doctor's order completely, including labs and dosing schedule, and then recalculates the dose to double-check it is correct. Each pharmacist processes one order at a time, so each order gets their full attention. Our pharmacists and pharmacy technicians are specially trained to prepare cancer medications. Your medication is prepared using a special process that ensures it is germ-free and the exact right dose for your body and your cancer. The technician uses a syringe to remove the exact amount of medication from the vial and adds the medication to a bag of fluid or to a syringe and places the label onto the bag or syringe. After the drugs are prepared and checked in the pharmacy, your infusion nurse checks to make sure that it's your chemotherapy and that the label matches your doctor's order. These multiple checks are to ensure your treatment is prepared accurately and timely to keep you safe and have the best shot at treating your cancer. As your treatment is prepared, you will be called back to our infusion suite by a member of our team. Our nurses have specialty training in administering cancer treatments. Depending on your treatment, you may need to take medications beforehand to prevent reactions. These medicines usually are given 30 to 60 minutes before starting your treatment. In the meantime, your nurse will access your port if you have one, or will just start an IV in your arm. Depending on your medication, your nurse might be wearing a blue safety gown. Once your medications arrive and you are ready for treatment, a final check is performed. Your infusion nurse will collect and verify your medication. A second nurse will then come to double check and sign off. You will be asked to verify your name and birthday multiple times in the process. It might feel redundant, but it is important for your safety. If you need to use the restroom, press the call light and your nurse will assist you. Your nurse will be checking on you multiple times during your infusion. The length of your infusion depends on your treatment. You could also receive multiple medications in one appointment. Your care team will tell you how long you can expect your infusion to take. When your treatment is completed, your nurse will disconnect your IV and wrap your arm or your hand. You can remove this after 30 minutes. You will receive care instructions and schedule future appointments. Before you leave, our care team will help you understand what to expect at home, including side effects and warning signs to watch for. You may also be given additional prescriptions to take at home to help you better tolerate your treatment. If you have questions once you get home, be sure to call your care team. They want to hear if you have any concerns. Because at Holden, getting you back to your life is our top priority, and your dedicated care team will be there with you every step of the way.